Now, the World Economic Forum, of course, as you're well aware, came to a close last week, Friday. Over that three-day event, delegates brainstormed a range of issues, from frustrating growth and investment in Africa being not exactly where it should be. Among the key issues under discussion was insufficient funding for healthcare right across the continent. I spoke to Dr. Harald Nusser, he's the head of Novartis Social Business, on the challenges that African economies are facing to meet the health needs of their growing populations.
Your impressions on WEF so far? I mean, the conversations here focus mostly on infrastructure, labour issues, government policy, but healthcare seems to have disappeared in the middle of that conversation. What are the opportunities you're seeing here at WEF?
It's of course always an opportunity to be at WEF because of the fabulous networking opportunities. But clearly, healthcare can be more enforced and need to be spoken about. Particularly because it's expensive on one hand, and on the other hand, it is a building block if you want to get out of poverty, because health is essential to drive economic growth.
When we talk about Africa and its healthcare policies, though, we always talk about the double threat, for lack of a better word. Infectious diseases, which is still pretty prevalent, but you're seeing this creeping wave of non-communicable diseases as well. What sort of outcomes are we looking at if we don't deal with those two problems effectively?
You're completely right. We need to deal with this dual disease burden. If we just keep in mind that hypertension kills more people prematurely than all infectious diseases together, we really are facing. And as a pharmaceutical manufacturer, it is important to make medicines available and affordable, but not only affordable to governments and to first-level customers. It is important that the patient who needs to pay out of pocket is not burdened with excessive markups towards him, because there are many intermediaries who also want to earn money.
So how do you balance these two things in tension between Novartis remaining profitable and still making medicines affordable to the end user?
From my perspective, it is important to start before the medicines are needed. From a public health perspective, it is absolutely critical to deal with prevention, to create the awareness in the communities that health-seeking behavior is important, diets are important, and physical exercise is important, and no abuse of alcohol, for example, in order to prevent NCDs from kicking in. When it comes to the pharmaceutical part, of course, making medicines available is an important thing, and to also continue to research new medicines, which comes at a certain price. But what Novartis is doing, offering a package of NCD-related medicines at a price of $1 per treatment per month to governments in low-middle income countries and to NGOs, to really make medicines affordable, high-quality medicines.
What about the research and development side of things? What investments are you making on that, specifically within African economies?
It is very important to stay vested in the space of malaria, for example. And we at Novartis have a strong track record of dealing with anti-malarial treatments. We have 2 phase 2 compounds, for example, in research and development, and we conduct studies in sub-Saharan Africa, but also in Asia, where we've seen first resistance effects. So it's important to have the next generation of medicines available when they are most needed.